The options are local anesthesia with some sedation, also known as conscious sedation, and the third option is general anesthesia. Your choice should be conscious sedation. What is this and why you should choose this? Keep watching. Even though hair transplant is a cosmetic procedure, it is still a medical procedure and can carry a lot of risks. You may have read in the newspaper someone dying during or after a hair transplant. If chosen carefully, you can have a successful transplant procedure and enjoy your new hair. I have personally cared for a number of patients who have had hair transplant as an anesthesia doctor. I'm telling you all this based on my personal and professional experience. Hair transplant requires anesthesia at different locations. One is the recipient side or the bald area where the new hair is going in. The other is the donor area from where the hair is coming out. It is usually the back of the head or the sides of the head. In some people who have limited donor area, hair can also be chosen from other parts of the body like the chest, arm, underarm, or even the pubic hair. This means anesthesia has to be provided for all these locations outside the head. General anesthesia consists of using anesthesia gas or intravenous medications to get the patient fully off to sleep. This is used in complex procedures like burns and other medical problems. For the purpose of this video, we will exclude general anesthesia as an option since we are talking purely of an elective cosmetic hair transplant procedure done for male pattern baldness. The risks of general anesthesia are not worth for a procedure like this. The main anesthesia used for hair transplant is local anesthesia. Before the local anesthesia is injected, an intravenous line is placed and the person is placed on monitors. The monitoring includes ECG, heart rate, oxygen saturation, and blood pressure at a minimum. This is because there are many transplant clinics and you want to make sure you're in a safe place. The commonly used local anesthesia medication is lignocaine or lidocaine mixed with epinephrine, also known as adrenaline. Some clinics do use long-acting local anesthetics like bupivacaine. Bupivacaine can be toxic to the heart. It is important to have monitoring and experienced personnel to deal with any such problems. Many times, a cream called EMLA may also be used, which is a mixture of lidocaine and prilocaine. You may also hear the name of tumescent anesthesia. So this is a practice where local anesthesia like lignocaine is diluted, mixed with epinephrine and sodium bicarbonate and is injected in the tissues until they are firm and tense. This was first used in liposuction or fat reducing surgery and then has been expanded to the hair transplant procedure. The anesthesia for a hair transplant may be required for many hours. The injection may be topped off with more doses as required. The transplant performing doctor may use additional methods like vibration, pressure, etc. as a distraction to reduce the feeling of the injection, and also a very small gauge needle so the patients don't feel it for the donor and the recipient areas. Now, in spite of all this, there is a lot of anxiety amongst people, and this is where conscious sedation is very important. When this conscious sedation is done by a specific set of anesthesia trained people, it can also be called monitored anesthesia care. In this, what happens is before local anesthesia injection, an intravenous line is placed just like before, monitors are attached. In addition, the anesthesia doctor or a trained personnel may administer medications like midazolam and fentanyl to make you more relaxed. The anesthesia doctor will stay with you throughout the procedure, and this is very important to have someone trained in case there are any problems to take care of that. In addition, helps with mitigating pain from some of the very sensitive donor areas which may not be adequately covered with local anesthesia. The conscious sedation rules may be different in different countries depending on where you live. It might be an anesthesia doctor or someone specialized in anesthesia who may be taking care of it. Because many people travel international for hair transplants, make sure you're aware of the local regulations. After all, you want to have a successful surgery. In addition, you may also be prescribed anxiety reducing medications like diazepam, lorazepam, clonidine, etc. In addition to all this, do talk to your surgeon about the conscious sedation and availability of experienced personnel to deal with complications. The presence of an anesthesia doctor or someone trained is so critical in these procedures. Although very rare, the use of local anesthetics can carry problems. There can be allergic reactions, there can be local anesthesia poisoning or toxicity. All these requires emergency management. There may be clinics that may be using medications like ketamine or propofol to give sedation. Although used for sedation, they can very quickly tip off to general anesthesia and can have a bad outcome. You all may remember Michael Jackson. Again, I personally don't think the risks of using medications like ketamine or propofol are warranted for a procedure like hair transplant. Local anesthesia with mild to moderate sedation should provide a very comfortable experience. Finally, just so you know, conscious sedation is just administration of medication so you feel comfortable when you're getting the transplant done. If you receive this type of sedation, you will be able to respond to any verbal commands either alone or if someone touches you lightly. The breathing will be normally going without any extra support. The heart and blood pressure will be maintained close to normal. I hope this will help you make an informed decision in choosing your doctor and anesthesia options. Make a right choice, pick your clinic wisely for a successful procedure. If you found any value with the video, hit the like button, share so other people can benefit from this. And if this type of content provides value to you, make sure you're subscribed to the channel. You can always check out other videos in the channel by clicking this link above. And good luck on your journey.